This is Kiefer. I'm a medical doctor, and by the end of this video you will be able to effortlessly recall all of the necessary facts for the oculomotor nerve shown in the tables below. I'll even be adding some high-yield bonus facts as well. Essentially, we're going to cover the oculomotor functions, which include most of the eye movements, via the superior, medial, and inferior rectus muscles, and the inferior oblique muscle. Pupillary constriction and accommodation, highlighted here in purple to demonstrate that they are parasympathetic functions, and eyelid opening via levator palpebrae. We'll be looking at cranial exit. In this case, the oculomotor nerve exits the cranium through the superior orbital fissure. We're going to remember that it's a motor nerve and that it is the third cranial nerve. We will be taking these words, assigning them into images, and fitting those images into a story so you can remember with greater retention. We're calling this one Cool Motors. The sun's out. Perfect weather for riding a motorbike. And, unsurprisingly, that motorbike has a pretty cool motor, which will be our reoccurring symbol for motor function, demonstrating that the oculomotor nerve has purely motor functions. This 3 on the back of the bike should serve as a visual cue to remind you that the oculomotor nerve is the third cranial nerve. But what's a bike without a driver? Well, we don't know his name, but I think I can tell which coast he comes from. We've added this West Coast stamp on the biker's helmet to remind us of the Edinger-Westphal nucleus, the parasympathetic preganglionic nucleus which controls the visceral parasympathetic functions of the oculomotor nerve. Also, you'll notice he's dressed in purple, the color we have chosen to represent the parasympathetic nervous system, stylish and functional. The somatic or voluntary muscles controlled by the oculomotor nerve have a separate nucleus in the midbrain called the oculomotor nucleus. We're not going to add a cue for that. Just remember, oculomotor nerve, oculomotor nucleus. The road seems to continue over that hill, between these flowers and some of their petals, which have blown onto the middle of the road. We'll use these petals in the middle of the road to remind you that the oculomotor nerve leaves the midbrain at the interpeduncular fossa. Between petals, interpeduncular. So what's this guy's deal? Where's he headed? Well, let's see what his options are. Here comes a road sign for the hotel chain Rest for Us. But how does he get there? Wow, okay. Somewhat confusing for a road sign, but you might notice that all of the arrows point up, down, or inwards, and apparently not outwards or laterally. If we were just to place a pair of eyes in the middle of these arrows, it would be an exact diagram showing the directions the rectus muscles, innervated by the oculomotor nerve, move the eye. Oh wait, we just did, allowing the Rest for Us hotels to represent the rectus muscles, which move the eye superiorly, inferiorly, and medially. Okay, we have a place to go, but what about a snack? Wait, there we go. Geez, the order these signs are turning up sure is convenient. In 50 meters, there's an exit for superb fish, almost like it could stand for superior orbital fissure. And this is an exit sign, so it should help you to remember that the exit for superb fish represents that the cranial exit of the oculomotor nerve is the superior orbital fissure. Now, I know what you're thinking. Hotels are nice, but what if this biker is more in the mood for camping? Don't worry. There is trailer park accommodation at the beach. This can help us to remember that the oculomotor nerve is the efferent motor limb of the accommodation reflex, transmitting motor signals which adjust the lens of our eye, helping to focus our vision at close distances. As you may have noticed, the sign is purple, indicating that it is innervated with parasympathetic fibers via the Edinger-Westphal nucleus. And what an animal-friendly beach. This seal playing with a beach ball should help you recall that the parasympathetic fibers that facilitate accommodation do so by innervating the ciliary muscle, which controls the shape of the lens, helping us to focus images. Seal, ciliary, it's a bit of a stretch, but I think it works. And since we're all about health and safety on this channel, and we're at the beach, we'll add a life vest, which should remind you that the oculomotor nerve is one of the efferent motor limbs of the vestibular ocular reflex, where sensory input from the vestibular organs in the inner ear, the balance center, are processed centrally, producing motor signals that propagate through the oculomotor nerve to the extraocular muscles, allowing you to fix your gaze on an object while your head is moving. Good stuff. But it seems some clouds are rolling in, and a few birds are flying over. For this next part, I'm going to use these strategically placed birds and clouds as a visual representation for a pair of eyes, with the birds' heads being the pupils, and the wings being the eyelids, and the cloud as the entire eye. I think it kind of works, no? And, wow, that bird's wings sure are catching some wind. It almost kind of looks like an eyelid rising too, so we'll remember it that way, as eyelid opening via levator palpebrae is controlled by the ocular motor nerve. And if the ocular motor nerve is paralyzed, we would lose that ability to open our eyelid, a clinical condition that produces a droopy eyelid, known as ptosis. First the wings, now the head. This is a weird bird. But if we return to the eye metaphor, with the bird's head representing the pupil, notice how it's moved downwards and outwards into the bottom outer corner of the eye. This is to represent down and out gaze, an important clinical sign indicating an ocular motor paralysis. This occurs because the abducens nerve moves the eye laterally into the green box, and the paralyzed ocular motor nerve, responsible for moving the eye up, down, and into the middle, will not be able to counter this force, making it unable to move the eye back in any of the directions represented by the red areas. Okay, I think we can agree these are some unique birds, and the purple bird is seen enough and decides to turn away. He ends up looking directly into the sun, and wow, its head starts to shrink, much like what happens to the pupils when introduced to increase ambient light, reminding us pupil constriction is facilitated by the ocular motor nerve, making it the efferent motor limb of the pupillary light reflex. Moreover, the bird being purple lets us know that it's a parasympathetic function, relying on signals relayed via the Edinger-Westphal nucleus. Now, if you look at both the clouds, which represent eyes, only the pupil introduced to more light, the purple pupil, has constricted, as the black pupil, representing down and out gaze and an ocular motor paralysis, is still normal size. Usually, light shone into one eye should make both pupils constrict. This unilateral constriction, otherwise known as anascoria, is meant to demonstrate that damage on one side of the ocular motor nerve leads to loss of constriction in the damaged eye only, known as non-consensual reflex loss, as opposed to consensual reflex loss, meaning bilateral loss of constriction, which presents when dealing with damage to the optic nerve. And what muscle facilitates pupillary constriction? Well, the iris. And to remind you of this, we'll add a blimp in the background advertising an Irish pub. Irish sounds like iris, sphincter muscle for pupillary constriction. You get it. For our final segment, we'll erect our last sign, which shows directions to the info. As you can see, the sign is not quite fully mounted on the billboard, so we're going to have to take care of that. We're going to keep the animal theme going here and place a duck here. He's wearing a little construction hat, so you know he's here on business. But what's he doing? Well, trying to pull up the sign, of course. And he has some kind of pulley system here that, when he laterally rotates the wheel, the sign is elevated. Pretty cool. But more importantly, it helps us to recall that the inferior oblique muscle, the info, is controlled by the ocular motor nerve, and it is responsible for abducting, laterally rotating, and elevating the eye. A duck for abduction, a laterally rotating wheel for lateral rotation, and an elevated sign for elevation. The arrow on the sign points laterally out of the image as well, which should serve as an additional reminder about lateral rotation. As a final little touch, we're going to add this little bullseye, an advertisement for archery, an activity for our biker. This is to help you remember our final clinical pearl, the division of central and peripheral ocular motor fibers. The bullseye, which sits in the center of the target, represents the ocular motor's central somatic fibers, which innervate the extraocular muscles, which happen to be more likely to be affected by vascular disease. This area is in the center to help you remember that these fibers are central, and it's red, like blood, to show that these fibers are more susceptible to damage from vascular disease. The purple periphery, the outer layer of the target, represents the parasympathetic fibers for accommodation and pupillary constriction. These are considered the peripheral fibers of the ocular motor nerve, which are more susceptible to damage by external compression. The arrow on the sign pointing towards the purple area can also serve as an additional reminder of compression towards peripheral fibers. And that's pretty much what you'll need to know about the ocular motor nerve. We've covered the rectus muscles and their functions, superior, medial, and inferior movement, not lateral, accommodation and pupillary constriction with parasympathetic innervation via the Edinger-Westphal nucleus, eyelid opening via levator palpebrae, and the inferior oblique muscle responsible for elevation, lateral rotation, and abduction of the eye. Regarding cranial exit, think back to the exit sign. What was it advertising? That's right, superb fish, representing the superior orbital fissure. Nerve type? Was there a cool motor in the video? You bet there was. And what number do you recall being on the back of the motorbike? I'm not even going to say it, but I'm pretty sure you got it. Run through this story one more time in your head, and these facts, along with the other clinical pearls presented, should be pretty easy to recall for you. In all seriousness, you nailed this. Wow. Please consider liking and subscribing if you appreciated this content, and we'll see you in the next video. Later.